as well as facilitating the acquisition of motorbikes. We will introduce electric motorcycles on a hire purchase scheme to eliminate the use of petrol and make their businesses more profitable. Mr. Speaker, Her Excellency the Vice President's Empowerment for Women and People with Disabilities program will also be launched this year. The program will target women and people with disabilities and other vulnerable groups to build their capacity and offer them access to finance to create their own jobs. Mr. Speaker, the Ministry of Communications, Digital Technology and Innovations will also focus on developing youth IT skills and fostering innovation. Under the 1 Million Coders program, young people will receive training in coding, web app development, digital marketing, and other digital skills. This initiative aims to equip them with the necessary skills for employability in the digital ecosystem. We must provide meaningful and relevant education to prepare our youth for today's technology-driven job market. Despite various reforms, issues related to low-earning incomes persist within Ghana's educational system. I'm committed to ensuring that quality education remains a top priority. The system we have inherited is outdated in many ways and must be realigned to meet the needs of the 21st century and the fourth industrial revolution. Recognizing the urgent need for national dialogue on education and in the spirit of inclusive governance, I launched the National Education Consultative Forum on February 18th in Ho. I look forward to the recommendations which we will incorporate into our sectoral policy reforms. Mr. Speaker, even though Article 38 of the Constitution guarantees equitable access to education across Ghana, 30 years after the Free Compulsory Universal Basic Education FQ program was implemented, its full objectives remain unmet. To tackle this issue, government will redefine the scope of basic education and introduce the Zero to Hero initiative to enhance foundational literacy and numeracy. Additionally, ICT training will be integrated into early childhood education at the basic level. Over the next 3 years, it will be expanded to cover at least 300 classrooms, 30 centers of excellence, 1,000 teachers and district teacher support teams focusing on the teaching of mathematics and literacy. This year, the Ministry of Education will fully implement a new curriculum for senior high technical schools and STEM schools, introduce a standardized national sign language for hearing impaired learners from kindergarten to SHS, and review the kindergarten and primary school curriculums. To increase access to quality education, we will scale up our social intervention programs like the capitation grants, the feeding grants for special schools, and the government's BECE registration initiative. Mr. Speaker, to promote inclusion and equity, the government will enhance and resource the Islamic Education Unit to recruit more Islamic and Arabic tutors for English-Arabic schools. We will establish STEM and TVET schools in underserved and peri-urban communities. We will provide scholarships to brilliant but needy students in deprived communities, especially for study in law, medicine, and engineering. We will support Islamic colleges of education with infrastructure and logistics, and will enroll youth in Zongo and deprived urban communities in the National Apprentice Program and offer free technical and vocational training. Mr. Speaker, it is important to continue to retain and motivate our teachers in all schools, especially in the rural areas. Government will begin plans for the implementation of the 20% allowance for teachers who agree to serve in rural schools. District assemblies are going to be involved in this scheme to ensure that the teachers are present and teaching in the schools that are selected. This scheme will reward such teachers for their sacrifices and ensure quality education nationwide, not only in urban centers. Mr. Speaker, as part of our Teacher Dabre initiative, the construction of teacher accommodation units to improve welfare and attract teachers to rural areas will commence this year. Mr. Speaker, no new school will be built in this country without teachers' accommodation. Mr. Speaker, honorable members, once again for emphasis and for the record, I, John Dramani Mahama, President of the Republic of Ghana, will not cancel the free SHS program. I will not cancel the free SHS program. I am determined to make it better by improving its implementation. And also, for the record, students who have benefited from the free SHS since its inception are about 3.4 million. The figure of 5.1 million beneficiaries, as put out by the previous administration, was an exaggerated and false narrative calculated to achieve political credit. Mr. Speaker, while the free SHS program has improved access, the implementation of the program leaves much to be desired. The outcomes of the ongoing National Education Forum will guide our reform efforts in this sector. Mr. Speaker, in line with our promise, the Minister for Education has announced the restoration of Parent-Teacher Associations, PTAs, in the running of schools. It is important for parents and communities to participate in the administration of their schools. The Ministry of Education and GHS will, however, ensure that PTAs do not impose unbearable financial burden on parents and students who cannot afford them. Mr. Speaker, the double track system remains a challenge, and we are committed to eliminating it by accelerating school infrastructure expansion and completing stalled educational projects. To fund this, the Education and Finance Ministries are working to uncap the GET fund so that we can accelerate projects in secondary schools. As promised, we have begun improving secondary school feeding, and the children are getting better quality food as I address you. Mr. Speaker, efforts to records capacity. Once completed, food procurement and management will be fully handed over to the secondary schools to do their own food procurement. Mr. Speaker, science, technology, engineering, and mathematics are central to national development, STEM. We will therefore expand STEM programs at all levels to equip all students for the global economy. We don't believe in building single standalone STEM schools. We believe that STEM must be part of the curriculum of every secondary school. Mr. Speaker, regional TVET centers of excellence will be established to provide practical skills. Every region will get a TVET center of excellence to expand technical and vocational education training. Mr. Speaker, honorable members, Ghana has consistently missed its gross tertiary enrollment targets, with a rate below 22%, far from the 40% goal that has been set by 2030. Despite over 460,000 secondary graduates coming out annually, 55% qualify for tertiary education, and only 35%, 161,000 of the 460,000 enroll in tertiary education, leaving over 300,000 without access. To address this, government is introducing a no-fee stress policy to eliminate tertiary admission fees, which currently serve as a barrier to higher education for some students. This will be supported by an enhanced student loan scheme, which is called the Student Loan Plus. The no-fee policy will also cover all persons with disabilities. And for emphasis, persons with disabilities will pay no fees for tertiary education throughout their study. And so PWDs who gain admission to tertiary institutions will pay no fees. Additionally, TVET enrollment will be increased from 11% to 20% to boost employment. Mr. Speaker, rising enrollment has strained university infrastructure, causing overcrowding and inadequate accommodation. We are determined to expand access, improve quality, and align tertiary education with national goals, particularly in STEM. Feasibility studies for new public universities or campuses of existing universities to be established in the 6 new regions will commence this year. Seed funding for these projects will come from the GhPage Fund in order to enhance access. Government will this year engage with the existing public universities to identify suitable sites on their campuses, acquired lands, for the implementation of the private sector participation in the provision of hostels project. This is a partnership between government, the universities, and private investors to expand hostel capacity on their campuses. This will allow more students to be accommodated on the campuses to allow for a better learning environment. Mr. Speaker, academic freedom will be upheld. We will not interfere in the administration of our tertiary universities. And our hope is that the institutions will ensure good governance in their administrative practices. Mr. Speaker, next, our health sector faces significant challenges that jeopardize the very foundation of affordable health care. The Ministry of Health has a total liability of nearly 15 billion cedis, when co-financing obligations, judgment debts, and payments to clear medical commodities at the ports are all put together. The last major hospital equipment replacement program was undertaken in 2014 when I was president. Since then, most hospital equipment in the Ghana Health Service facilities have deteriorated or broken down. Mr. Speaker, the Agenda 111 program, which was started as a knee-jerk reaction during the COVID-19 pandemic, when the Ghanaian public had begun to appreciate the significant investments that the previous NDC administration had made in healthcare facilities, and began to lament the many hospital projects that had stalled under the previous administration, a promise was made to build 111 hospitals. Mr. Speaker, I'm sad to note that there is no dedicated funding source for such a gargantuan project. There is no dedicated funding source for this gargantuan project. Mr. Speaker, for the record, as I speak, not a single Agenda 111 hospital is operational. In any part of Ghana, I challenge you, not one is operational. Mr. Speaker, and it is worth disclosing that $400 million has already been disbursed under the Agenda 111 project. Mr. Speaker, at a rate of approximately $80 million per hospital, this $400 million spent could have completed and made operational at least 22 of those hospitals. Mr. Speaker, I believe that the money should have been focused on completing a number of hospitals and making them operational instead of spreading it over the current 111 hospitals. As I speak, some are at the foundation level and not a single one is operational. I have directed the Minister for Health to present us with a plan on the way forward for this program. And let me add that we are open to public-private partnerships and franchising to complete and operationalize these hospitals. Mr. Speaker, one of the most pressing issues confronting our health sector today is the USAID's sudden 90-day pause in services without prior notice and the looming threat of complete withdrawal of programs that do not align with the USAID's strategic interests. Programs that will be affected include the delivery of medical commodities to regional medical stores and health facilities in the Upper West, Upper East, Northern, and Savannah regions. USAID support for the National HIV/AIDS Control Program includes the supply of antiretroviral therapies in the Western, North, and Afro regions. These will also be affected. The withdrawal puts at risk approximately $78 million in earmarked funds for malaria, maternal and child health, nutrition, and HIV/AIDS. It also covers some programs being run at the Noguchi Memorial Institute in research. The unpredictable nature of disease outbreak suggests we must make our health systems more resilient to shocks. Since October last year, Ghana has faced a severe cholera outbreak. As of February 17, 2025, I'm sad to report that 6,300 suspected cases, 545 of these cases were confirmed to be cholera, and unfortunately we lost 49 of our compatriots. The outbreak has affected 118 districts across the Greater Accra, Central, Western Ashanti, and Eastern regions. To control the situation, we have launched an aggressive vaccination and public education campaign, among other interventions. Mr. Speaker, sanitation within the context of infectious disease outbreaks, personal hygiene, and environmental sanitation must be a major priority for us. Our cities and towns must be made cleaner than what we currently have. We commit to right the wrongs and keep our cities and communities clean through appropriate investment, supervision, and performance tracking in the sanitation sector. Mr. Speaker, as I speak, the Upper West region is facing a severe meningitis outbreak. And I know, Mr. Speaker, you have made an important contribution to ameliorate the situation in your region, and I commend you for that. As of February 17, 2025, 135 suspected cases of meningitis were reported. 22 of those cases were confirmed, and unfortunately, 16 deaths have been reported across 10 districts. We've instituted free treatment for affected persons and deployed a strong national team of health experts to encourage early reporting to health facilities of suspected meningitis. Mr. Speaker, as outlined in the 2024 manifesto of the NDC, my administration is actively developing the framework for the rollout of the free primary health care program. When fully implemented, this initiative will mark a significant step towards Ghana achieving goal number 3.8, which is universal health coverage of the SDGs, by eliminating financial barriers to basic health care access. Also in line with our 120-day manifesto commitment, the composition of the technical committee is far advanced, with plans to establish the Ghana Medical Trust Fund, also known as Mahama Cares, in the coming weeks. Mr. Speaker, honorable members, this fund will be dedicated to financing the treatment of non-communicable diseases, which have seen a significant rise over the past decade. As part of this initiative, the government is committing to allocate financial resources towards this project in 2025, with further support to be mobilized from private sector partners to ensure the sustainability of the fund. Once operational, the Ghana Medical Trust Fund, otherwise known as Mahama Cares, will directly address the financial burden of patients who require dialysis treatment, cancer care, and other critical non-communicable disease-related interventions. Together, the free primary health care, which will focus on early detection and prevention and treatment, and the Ghana Medical Trust Fund program, which will focus on relieving the financial burden of treating non-communicable diseases, will help to revolutionize Ghana's healthcare system by improving healthcare accessibility and outcomes, and enhancing productivity and well-being across the country. Mr. Speaker, Ghana will become the pharmaceutical manufacturing hub of West Africa. And my previous record in government speaks for itself. When I injected funds into Ghanaian-owned pharmaceutical companies to expand their production capacities. Mr. Speaker, as this exciting phase unfolds under the 24-hour economy initiative, we must strengthen every aspect of our pharmaceutical industry. And this includes the Food and Drugs Authority and the Customs and Security agencies in order to avert the use of fake drugs and the importation of illicit drugs into our country. We await thorough and unbiased investigation into the alleged opioid pill importation into Ghana and other West African countries. The outcome will be shared, and I can assure you necessary action will be taken. Mr. Speaker, as a social democrat, I'm resolutely committed to eradicating all forms of discrimination in our society. Our vision is to foster fairness and cultivate an inclusive environment where everyone can engage fully and equally in social, economic, and political life. With my Vice President, the history-making Professor Nana Jane Opoku-Agyeman, we will engage with all stakeholders, including our development partners and civil society organizations, to prioritize gender equality, equity, and social justice. We will establish strong social protection mechanisms and enhance legal safeguards for women, girls, and other vulnerable groups. Our initiative would include enacting comprehensive laws and policies designed to dismantle harmful social norms, to enhance access to crucial resources and opportunities, particularly for young women, and reduce overall vulnerability within our society. Mr. Speaker, I'd like to take a moment to commend you and this House for your unwavering support and guidance, which were instrumental in passing the Affirmative Action Act of 2024, Act 1121, during the 8th Parliament of the 4th Republic. My government is dedicated to successfully implementing this act to ensure gender equity across the political, social, economic, educational, and cultural spheres. The Ministry of Gender, Children, and Social Protection is actively collaborating with relevant stakeholders to guarantee that this act is fully operational, including attaining the 30% target quota for women in political appointments. I'm pleased to report that women currently make up 23.21% of all appointments, and we are diligently working towards reaching the targets set forth in Act 1121. I'm, however, concerned about achieving gender balance, especially at the local government level. Very few women have mastered the courage to apply for the positions of metropolitan, municipal, and district chief executives. And unfortunately, the few who have courageously applied have been edged out on very flimsy and parochial grounds. It is my hope that the National Constitution Review Conference will clear a pathway for the election of DCEs. The Gender Ministry will then be obliged to encourage and support more women to apply and stand for these elective positions. In our pursuit of empowering women, Mr. Speaker, we'll establish the Women's Development Bank. This will be a specialized financial institution designed to support businesses owned and led by women through the provision of low-interest loans and tailored financial services offered under very flexible terms. Consultative processes are underway to ensure the successful launch of this bank. And as part of our 120-day social contract, the Minister for Finance is going to allocate initial funding for the Women's Development Bank in the upcoming budget that will be presented to this House. Mr. Speaker, we're also implementing measures to expand the Livelihood Empowerment Against Poverty program under our Big Leap initiative. As we work towards completing the Ghana National Household Data Census by this year, 2025, we'll reassess the status of LEAP beneficiary households to facilitate the enrollment of new beneficiaries. Mr. Speaker, we are committed to enhancing the legal framework surrounding disability rights by passing the Persons with Disability Amendment Bill. Additionally, we will introduce a legislative instrument to strengthen further the provisions of the Persons with Disability Act, Act 715 of 2006. We reiterate our commitment to ensuring that individuals with disability have access to free tertiary education and equal opportunities to pursue their academic and professional ambitions. Mr. Speaker, the government intends to ensure the implementation of legislation that enjoins public and private employers to reserve 5% of their employment for persons with disabilities. I am aware that a private member was shepherding this bill. Government is going to support that motion in order that 5% of all employment is reserved for persons with disability. Mr. Speaker, Ghana's sports sector, once again, which was a shining example of excellence within Africa, now finds itself at a very critical juncture. Historically, our nation has been celebrated and has had remarkable achievements in boxing, football, and athletics. Unfortunately, this is no longer the case. However, recent years have unveiled depressing structural deficiencies in administration, funding, infrastructure, and talent development. Immediate and comprehensive reforms are imperative to reclaim our rightful place on the global sports stage. Mr. Speaker, we will develop a comprehensive national sports policy to align with international norms. This policy will be accompanied by an exhaustive review of the Sports Act of 2016, that is Act 934, and the rigorous enforcement of the Sports Regulations 2023 LI 2477. Infrastructure development remains paramount in our strategy. The government is committed to refurbishing existing national stadia, completing youth resource centers, and constructing new sports facilities in the new regions. We'll also prioritize community recreational facilities to foster greater participation in sports at the grassroots level. Recognizing the critical role of youth development, we're implementing a significant overhaul of grassroots sports with the establishment of the School Sports Authority. This body will oversee structured inter-school competitions and talent identification initiatives essential for nurturing future sporting champions. Over 60% of Ghana's elite athletes have emerged from these school sport programs. The ministry has now been renamed the Ministry of Sports and Recreation. To acknowledge the significance of recreation, we will launch a National Recreation Day. This will be a monthly initiative centered on community engagement alongside an annual National Recreation Festival. These initiatives will encourage keep-fit activities and promote active lifestyles. It will promote traditional games and strengthen community bonds. Next month, the senior national team, the Black Stars, which is now a pale shadow of its former glory, will play 2 World Cup qualifying matches. I've instructed my office and the Minister for Sports and Recreation to hold the Ghana Football Association accountable to the people of Ghana as we prepare for these games, especially regarding the budget of the FA. There will be no secrecy in how much the government spends on the national teams. The budgets presented by the FA and other sports associations must be known by the public. After all, it is the taxpayers' funds that are used to fund these activities. The reduction in government expenditure and waste reduction applies to all sectors of the economy, including the Ministry of Sports and Recreation. Mr. Speaker, culture and creative arts remain vital cornerstones of our national development strategy, playing a significant role in job creation, cultural exchange, and economic growth. In recent years, the ministry has launched transformative initiatives to position Ghana as a premier global destination, and this is positive. These positive initiatives aim to harness the country's rich cultural heritage, natural beauty, and our dynamic creative sector. Our flagship initiative, the Black Star Experience, aims to establish Ghana as the gateway to Africa for the global diaspora, featuring thoughtfully curated cultural, historic, and creative arts experiences in collaboration with the private sector, diplomatic missions, ministries, departments, and agencies. Our aim is to position the Black Star Experience as a uniquely Ghanaian tourism brand. The Pan-African Month will be a part of the Black Star experience. It will include street carnivals, a film week, a fashion festival, a food fair, theatrical and drama performances, concert party competitions, and monthly domestic tourism destinations. We will strategically promote meetings, incentives, conferences, and exhibition tourism to diversify our tourism offerings. Ghana's peaceful and democratic environment positions us as an attractive hub for international summits, business conventions, and high-profile gatherings. We must capitalize on this unique advantage to maximize our benefits and strengthen our reputation as the country that is closest to the center of the world. We're also committed to revitalizing the Accra Marine Drive project, a significant urban redevelopment initiative which was designed to transform approximately 241 acres of Accra's coastline into a vibrant tourism and economic hub. Although the cabinet approval for this vital project was achieved during my presidency in 2016, progress has stalled. We'll reassess the work completed and take decisive action to bring this all-important project back on track. We will develop the Osu Castle, the former seat of government, and the area around it as a tourist attraction. It will have a pedestrian precinct with arts and craft markets, jewelry and gold markets. This approximate 22-acre land will become a destination for tourism. Mr. Speaker, our road network is the cornerstone of our nation's infrastructure, facilitating over 90% of the transportation of goods and services across this country. This vital network is critical in supporting agricultural growth by linking farmers to markets, lowering transportation costs, and ensuring quicker access to essential supplies and services. The resulting interconnected benefits foster a vibrant economy and enhance the livelihood of countless of our citizens. Mr. Speaker, while the previous government has made lofty claims about achieving unprecedented milestones in the road sector, available evidence does not support its assertion that it constructed over 13,000 kilometers of new roads. Instead, it has perpetuated a narrative that presents road maintenance and rehabilitation efforts as new construction projects, misleading the public about what has been achieved. The proportion of poor roads has increased, especially in urban centers, where the number of roads in disrepair surged from 46% in 2015 to almost 60% by 2021. Therefore, Mr. Speaker, our road sector is in crisis, mainly due to years of mismanagement. As many as 85% of awarded contracts in the road sector have stalled, and the contractors have stopped work due to non-payment, and most of them have parked their equipment off-site. Mr. Speaker, as of December 2024, unpaid bills owed to contractors in the sector exceeded 20 billion Ghana cedis for work that had been carried out between 2018 and 2024. For instance, the Ghana Road Fund obtained a loan of 600 million Ghana cedis in March 2018 to refinance outstanding debts and borrowed an additional 1.2 billion Ghana cedis from a syndication of banks in November 2019. Alarmingly, upon assuming office, the Ghana Road Fund still had outstanding payments, including some as low as 2,000 Ghana cedis, dating back to 2018. Current commitments for road projects that are unpaid currently stand at an astonishing 105 billion Ghana cedis. Despite these considerable challenges, this government remains steadfast in its commitment to prioritize vital infrastructure projects that address the pressing backlog of poor roads. Our strategy will be anchored in executing our flagship initiative under the Big Push program. The Big Push will see major rehabilitation of many key roads in the feeder roads, urban roads, and highway sectors. We'll also undertake the following key initiatives to revitalize the road sector. We'll reintroduce tolls, road tolls, using modern technology. We'll rationalize the road sector portfolio to focus on high-impact initiatives. Mr. Speaker, we will uncap the road fund in order that it can accumulate more money to pay for road maintenance. Mr. Speaker, we'll minimize sole source procurement to encourage competition, competitive bidding, and enhance public transparency in the procurement processes. Mr. Speaker, the drip equipment, which was acquired at the last moment as a knee-jerk reaction for electioneering purposes, will be reorganized into regional mobile maintenance units